You're a third-year medical student on your first rotation in the CCU. Your coat is perfectly pressed, stethoscope is perfectly positioned, and you have about a year's supply of pens in your pocket. You're ready. In fact, you're pumped. You're ready to begin morning rounds with the team. You excitedly walk into the first patient's room, and the resident explains that this is a 48-year-old female with Takotsubo's cardiomyopathy, and goes on to deliver the rest of the case. Feeling a bit overwhelmed, all you can think is, Tako who? You vaguely recall a cardiac condition called Tako something. You don't want to look bad on your first day and start to panic. What if the attending asks you a question about the case? You have about 10 minutes before the resident finishes the presentation, so you have to think fast. The institution just subscribed to ClinicalAccess, and that seems like a good place to start. You pull your iPad mini out of your pocket and start searching. You really want to quickly learn all you can about this cardiomyopathy, so you type in the disease name rather than a specific question. You don't really remember the entire disease name, so you try your best. Takocardio. The first result is perfect. What is Takotsubo cardiomyopathy? You click through and get a quick answer which defines the disease. You can now build on this to better understand the condition. You scroll down the page to see the related questions. These are just what you were hoping for. You see questions about diagnostic criteria, signs and symptoms, and diagnostic studies. You're most interested in the diagnostic criteria, so you click on that question. You find out that there are 4 criteria that must be met to fulfill the diagnosis. There is even a great snapshot of an echocardiogram to depict the findings. You scroll down the page and notice a link to McMaster Plus. You click there and are taken directly to the most relevant evidence-based medicine articles. You want to cover all the bases and make sure you have the latest information to provide the best patient care. But wait, what causes this? You ask ClinicalAccess and quickly find an answer. You continue to look through a few more questions as the case presentation draws to a close. You read up on treatment and prognosis. You breathe a sigh of relief. The presentation is completed and the attending looks to you and says, "So, what is the pathogenesis of Takotsubo cardiomyopathy?" Since you just refreshed your memory using ClinicalAccess, you answer the question perfectly. You smile as the attending says, "Excellent," and moves on to the next student. ClinicalAccess saves the day. Again.